So in this video, we will discuss what is the difference between a dental implant over a dental bridge, or why we should use a dental implant compared to dental bridge. So the first point is, when we use a dental implant, there is no damage to adjacent teeth. Whereas when we place a bridge, dental bridge, there is always crown cutting of the adjacent teeth. So it leads to damage. So this is the first and most important advantage of using a dental implant compared to dental bridge, because we are not causing damage to any of the adjacent teeth. We are simply placing implant on the edentulous area that is present. The second point is that the bone height and width can be maintained. So as we know that when there is edentulism, when we lose a tooth, the bone gradually starts to resorb, and that resorption can happen both vertically as well as horizontally. So when we place a dental bridge, the resorption process will go on. But if we place a dental implant over the edentulous site, the bone height and width is maintained. There is no resorption or very minimal resorption. The third advantage is that in distal end situation, or multiple missing teeth, or in long span edentulism, we cannot place a dental bridge, because as you can see in this image, this is a distal end situation. So what will happen in this case? If we place a dental bridge, then obviously we have to take support from the adjacent mesial teeth. Okay, so these mesial abutment, it will go undergo torsional force, and there is a high probability of denture failure. Whereas in case of dental implants, we can easily place in such kind of edentulous cases, because we are not taking support of any adjacent natural teeth. Also, in case of complete edentulous situation, obviously if there is no teeth present, then you can't place a bridge over it. In those kind of situation, the best alternative compared to complete denture is full mouth dental implants.